Sexual health is a health issue that is very stigmatized. So people aren't nearly as keen to go and hear about sexual health or learn more as they are about, say, heart disease or something like that. So it can be very difficult to get an audience for health promotions and very difficult to get people the information they actually need. I am looking at sexual health promotion in universities. It's a really interesting intersection between social issues like the stigma, like I was talking about, and also understanding the medical concepts or the scientific concepts on the other side. So that's why I was so interested in looking at it. I've been using a bunch of different ways to try to get some info on this. So I've been doing interviews with people who are already doing sexual health promotion in universities, as well as interviews with professional sexual health care workers, to use that information to come up with something that would be useful for a broad range of university students. I also did some surveys. So the most important one was the student survey I did, where I got people to anonymously tell me all about their private lives and, and the types of things that they would want to see in a sexual health promotion. And that's been really interesting to look at, because we've been making a lot of assumptions about what kind of thing will draw people to a promotion, but it was really good to actually have some data about what people prefer and how to get people there. The main end goal of my research is to come up with a program that can be used across many different universities in Australia. The main people who would be interested in doing sexual health promotion within their communities, they have a lot of enthusiasm, they have a lot of drive, but they're generally only in the role for a really short time, and often they don't have any opportunities for training when it comes to sexual health. So trying to come up with something that is fun and engaging, but also really easy to run, and a way to get them in touch with sexual health care professionals so that they can always get more help and advice. That's been the main thing that I've been looking at. So far, I've got a couple of trials that I've been going with it, and so far it seems pretty good, but we're gonna have to wait to the end of the PhD to see how it goes.